First of all, I just want to say that up until 8 p.m. last night, there were 0 cases of COVID, so new cases of community transmission, which was obviously positive. There were 7 cases at that stage that were acquired overseas, and those cases were, of course, in our in our quarantine hotels. I also just want to thank the community more broadly because in the last 24 hours up to 8 p.m. last night, we had almost double the testing that had occurred in the previous 24 hours. There were 11,922 tests compared to 5,333 in the previous 24 hours. So I want to thank the community for that, and certainly, particularly based on what I'm about to say, that no one should underestimate the need for continued testing if you have any symptoms of cold or flu-like illness. We do not want COVID as a Christmas gift for our community. So please make sure that you do get tested. Do what you've done for the last now 11 months in New South Wales, and that is, as a community, our community has been fantastic and stayed with us on the journey and largely had that testing. But we do have another unfortunate situation of a positive case here in New South Wales that came in after the 8 p.m. deadline last night. A 45-year-old gentleman who had symptoms on Saturday was tested yesterday, being Tuesday, and just after 7 a.m. this morning, a positive result from his test was given. Obviously, there'll be more work to do. This is very preliminary advice to the community, on the basis that New South Wales Health and the government has always shared all information with our community as soon as possible. But we do still have to do, if you like, checks just to make sure that it is a valid positive case. Indications at this stage are that it is. But as we're well aware, there can be shedding of the virus for months after someone's had it. So we're doing those checks. This gentleman drives vans carrying international and other aircrew back and forth to the airport. So the concern, of course, is that it highlights what I was talking about last week when I said that the New South Wales government's focus, as the virus seemed to be contained in terms of community transmission, our most exposed areas included, or principally around our borders. Obviously, we may be an island, but we are not totally isolated from the pandemic that is raging across the world. International aircrews are vital for New South Wales and indeed Australia. They are bringing in our freight, and of course they're bringing back our Aussies. So we need to be cognizant of the need to work with the airlines to try and ensure that their aircrew are able to come into the country, into New South Wales and into Australia, but also to make sure that they do it in a safe way, a way that keeps our New South Wales community safe and preferably away from the possibility of this virus. It's particularly challenging for New South Wales because we have somewhere between 2,000 and 3,000 aircrew coming in internationally every week. There's no doubt that that would far exceed the numbers in any other state or territory. It's fair to say New South Wales continues to shoulder the challenge of bringing in people from overseas, that is Aussies, but also bringing in freight. So we are now going to have to look more extensively at some of these issues that were briefly mentioned, I understand, last week at National Cabinet following my comments in a public place last week to you and to others last week. Where do we go from here? Well, middle of last week, I had a discussion along with senior health officials with a number of international airline representatives we canvassed with them the fact that New South Wales Health and the government here, me particularly as Health Minister, were very concerned about the possibility of the virus coming in with international aircrew. You'd remember that we had the 66-year-old lady at the Ibis and the Novotel 2 weeks ago, and that would appear on the basis of the genomic sequencing to have been most likely to have been connected with a US aircrew, as the genomic sequencing showed the top matches across the world were actually from the US. So we were discussing what further steps we could take that would work for the airlines but work for our New South Wales community, and indeed which would perhaps set the basis for the broader issues across Australia and to be discussed then at National Cabinet. I think this case now drives home the urgency of those issues that were highlighted and foreseen by us here in New South Wales. I've spoken quickly to the majority of ministers in the country and just indicated, that is this morning, and just indicated that I'd be making this comment today and just indicating that we all need to be looking at this. And as the other states step up, hopefully, to have more international flights, they will also hopefully be able to implement a regime that we can all agree on. But if not, then New South Wales will certainly be making sure that we do everything we can to keep people safe. At this point, we will actually be implementing more discussions, probably within the next 48 hours, with the international airlines. But the inclination that the New South Wales government has at the present time is to say to international air crews and airlines that international air crews coming into New South Wales will be most likely to be required to quarantine in the same way as any other international visitors or returnees, Australians returning to Australia. The difference would be, the difference would be, of course, that they would be in a quarantine environment, but not necessarily for the full 14 days, because they obviously have usually turnarounds between 24 and 72 hours. We have a good quarantine system where police look after the hotels. We obviously have our health hotels too for other categories of people who need that additional health assistance and for positive COVID cases. But that's what we're looking at the moment. And we'll have those discussions with the international airlines, as I said, in the next 24, 48 hours.